And if everyone is ready, let us begin tonight's session with a very, very important questions that we have often get asked, and that will be our main topics for the training tonight. The first questions that I always get asked, and I would like you to help answer or educate us, is when it comes to immune boosting products, people often only think about vitamin D, vitamin C, or zinc instead of transfer factor, but we know that transfer factor is very powerful immune boosting. What can we do to better educate consumers about this? Please help us.
Yeah, Aim, it's a great question. It's one we get a lot because a lot of people don't know what transfer factor is. But before I answer that question, let's first understand what transfer factors are and where do they come from. So transfer factors were discovered in the 1940s when a pioneering immunologist, his name was Dr. Sherwood Lawrence, and Dr. Lawrence was studying immune cells from a person who had survived an illness. And what he noticed is that by transferring a specific portion of that person's immune cells to another person who hadn't been exposed to that illness, that they would actually be protected from that same illness. And he called that transfer factor. Since at the time he didn't know what they were, he just knew they were factors, and he knew that they transferred immunity, and so he called them transfer factors. And this was really the beginning of an area of immune research that we now call cell-mediated immunity. And since Dr. Lawrence's discovery, there have been hundreds and hundreds of scientists who've studied transfer factor and published thousands and thousands of papers about transfer factor. So what are transfer factors? Well, they're not vitamins, they're not minerals, they're not herbs or botanicals. Rather, what they are small peptides and proteins. And as I mentioned, they were first discovered in blood. Now, later, they were also found in cow colostrum as well as chicken egg yolks. And that's where 4-Life transfer factor comes from. So what is colostrum? Colostrum is the first milk that is produced by a mother during the late stage of pregnancy and the first few days following delivery of the newborn, or in animal world, they call that a neonate. Colostrum is yellow in color, so it's not white like regular milk, and it's often considered one of the most potent natural immune boosters in all of science. Now, on the other side, egg yolk is the nutrient-rich portion of the egg. Its primary function is to supply food for the development of the embryo. So in 4-Life products, the egg yolk comes from chickens. So that's where we get transfer factor at 4-Life. So what do? Well, transfer factors, if you've been with 4-Life for a while, you will recognize the saying, the transfer factors help recognize, they help respond to, and they help remember health threats. So what does that mean? It means that 4-Life transfer factor helps the immune system quickly identify what those threats are. You know, what is this threat that's coming towards me? Transfer factor helps us understand and identify what that invading threat is, right? We have to be able to identify it if we want to know how to respond to it. Then 4-Life helps speed up the immune system to respond to that potential threat once it's been identified. And then finally, 4-Life transfer factor helps your immune system remember the specific makeup of that threat, right? Because once you've identified that threat, once you have responded to that threat, you want to be able to remember that threat so that anytime that same threat comes around, we'll know how to respond to it in a much quicker way. So transfer factors, in a nutshell, help recognize, respond to, and remember health threats. Okay? So that's the educational piece about what transfer factor is. So back to the question, when it comes to immune boosting products, what can we do to better educate consumers about transfer factor? Well, like I just did, we first start by educating consumers on what transfer factors are, how they work, and their role in immune system health. Then you can seek support and collaboration with healthcare professionals or experts or 4-Life R&D to provide credibility and to be able to share their insights into the research and to the benefits of 4-Life transfer factor. Of course, everybody knows social media, so you can utilize social media platforms to share little bits of pieces of information, right? We're not going to share a whole presentation on TikTok or Facebook like we're doing now, but you can share bite-sized pieces of information. You can share testimonials. You can engage with consumers on their questions about transfer factor. And then finally, you can seek out those testimonials from customers who are taking it, who are satisfied users, and allow them to share their experience with transfer factor, which provides real world experience on their effectiveness. So AIM, I think if we do all four of those things and we all understand what transfer factor is, then we can start to make headways into being able to make consumers aware of what transfer factors are, and that there's not only just vitamins and minerals.
Thank you so much, Dr. Vollmer. That is a very elaborative answer to my questions, because this has really helped people understand the importance of transfer factor and how it really helped the immune system. We have a very profound knowledge and research to back this up, and we're not just making it up, aren't we? So let me please proceed to the next questions that I've always found very important that people would like to know. So the next questions will be, do transfer factors from blood and from cow's colostrum and from chicken egg yolks yield the same immune protection? So please advise.
Sure. And I have to tell you, I love this question because it was a question that I had when I first came to For Life many, many years ago. Because we talked about, right, we discussed earlier that the early research in transfer factor was in blood, and that research spans over 50 years. However, the research in colostrum and egg transfer factor, it's relatively young compared to the blood research. And we know, of course, that For Life is leading those efforts in that immune research. So to answer this most important question has been truly a real challenge, to say the least, and one that we recently, fortunately, have overcome. And I believe there's a good story to tell on how we got to this point. So the obstacle of being able to answer this question centered around how can we obtain a blood-based transfer factor? So currently there is only one known supplier of a blood-based transfer factor, and they are not in the US. There's also another complication. It's considered a drug in that country, and it's not widely accessible through certain pharmacies. So the ability or the means to obtain this sample has been a years-long struggle for us at For Life. Now, fortunately, one of the benefits of For Life is that I get to travel to events, I get to talk to people, I get to go to the different markets, and I had the opportunity to visit that country that has the blood-based transfer factor just over a year ago. And with the help of the For Life office in that market, the local office, we were able to acquire that drug. Now, through ways I won't go into detail, I was able to bring a blood-based transfer factor drug back to the US for testing just last year. Okay, so let's look at the data. So let me explain first what you're going to see. Okay, can we have the next slide? Here we go. Okay, this is data that comes from our validated, published natural killer cell assay, and it utilizes an independent third-party testing lab called Reach Bio. So this isn't For Life doing this test. This is an independent lab doing this test. And what it's doing is essentially looking at how transfer factor can activate immune cells to go after a health threat. Remember, recognize, respond to, remember health threats, right? So this assay is actually seeing how transfer factor responds to that health threat. So in this assay, in this study, in this method, higher numbers correlate to better activity, and that's a good thing. And as you can see, For Life transfer factor, either from colostrum or from egg, show as good or better activity than that of blood-based transfer factor, which I represent by a picture of Dr. Lawrence. Now, to the best of my knowledge, this is the first time that there's ever been this important comparison. The question's been out there for many, many years, but this is the first time we've actually been able to answer the question. And you on this call are amongst the first people to actually see this. We're hoping to actually publish this data later this year because it's that important. Why is it important? Because it bridges 80 years of transfer factor research, starting from the 1940s, starting with Dr. Sherwood Lawrence, to now, being able to bridge that data, bridge that research with cutting edge technologies, all of course being led by 4Life Research. So AIM, that's the answer to the question. Blood-based transfer factor, 4Life transfer factor, similar or better activity.
Wow, Dr. Vollmer, that is such a discovery. What a discovery that we have found. 4Life has owned this patents that we have around the world, and that we're able to share this knowledge and this important message to everyone around the world. So I do hope that this message has found the way to everyone tonight, and that we start sharing how effective that 4Life transfer factor is, almost beyond the discovery that Dr. Sherwood has discovered earlier. But that is not it for tonight's sessions. We have even more important questions that we have received all the time, which is what makes 4Life transfer factor different from other transfer factors products in the market? That would be our next slide and the next questions. So this is something that what sets us aside or make us more outstanding or different. So please advise. Thank you.
That's a great question, and it's an important question because you as consumers and as affiliates need to be able to explain what's the difference. Is 4Life better? Why is it better, right? That's how we differentiate ourselves in the marketplace. And I'm going to discuss 3 main points to illustrate how 4Life transfer factor is different than other transfer factors on the marketplace. So first, as I mentioned before, transfer factors are small peptides and proteins that educate the immune system to recognize, to respond to, and to remember health threats. Now, by comparison, they are relatively smaller in size and abundance than many of the other components in colostrum. And so they require these special filtration procedures to be extracted from colostrum or from egg yolk. Now, the process that 4Life uses involves several crucial steps when it comes to colostrum. The first step is you have to defat the colostrum, you have to pasteurize it, and then you concentrate it through these very, very fine filters. You can see in this diagram that utilizes a process called ultrafiltration and nanofiltration. So these 2 different filtration procedures give us ultrafactor and nanofactor. Now, of course, AIM, you mentioned patents. 4Life has several patents around these filtration methods to ensure that they are proprietary, that they're owned by 4Life, and that they're exclusive to our company. And that's really, really important, right? Because you can go out there with confidence and say that 4Life is the only one who has this patented technology to extract out these important molecules out of colostrum or egg, different than anybody else. So that's the first way we can differentiate how we are in the marketplace with other transfer. But I'm going to talk about 4Life. This is the second way that 4Life transfer factor is different than those transfer factors out on the marketplace. So the second way, and this is really big news for us, it's recent news. You may not have even heard it yet. This could be the first time you hear it. 4Life Transfer Factor Plus is the only transfer factor on the market that is NSF content certified. So what does that mean? Well, NSF is an important independent global organization that was founded in 1944. They're actually the company that certifies our GMP processes as well. And NSF certifies and tests products out on the marketplace, just like 4Life Transfer Factor Plus, so that consumers can feel safe about the products they use, right? We all want to feel like a product we're taking is safe and effective. Now, for a product to be NSF content certified, it has to undergo very, very rigorous tests that prove the product has quality and it has safety. The NSF also tests products to ensure that the claims on the label, so anything that is on the label, is accurate and correct. 4Life Transfer Factor Plus is the only transfer factor product on the market that has that certification. So that's a new piece of information that you can go out there with to give you confidence that 4Life has the best transfer factor product out on the marketplace. The third and final, and the last part, is probably the question that everybody thinks is, well, how does this compare directly with 4-Life Transfer Factor compared to others out in the marketplace? So we again go back to our natural killer cell assay that we talked about earlier, right? Remember, we are activating natural killer cells to go after a health threat. It's that same assay. And we purchased several transfer factors that are out on the market, or colostrum products that are on the marketplace. Now, I should note that I hide these products so that you don't know what they are. But interestingly, when we went out to purchase them, most of them are more expensive than our transfer factor. So, in fact, one of them is actually double the cost of our transfer factor. So you know with your transfer factor, with our transfer factor, that you're getting a cost-effective product. Now, we took these products, we put them in the assay, we tested them directly against one another using this independent third-party lab. And I have to say, remember, again, greater is better, right? Greater is increasing natural killer cell activity, and that's a good thing. And I would say, if you look at the results, that they speak for themselves. So what do the results show us? 4-Life Transfer Factor showed better natural killer cell activity than every product we tested. Now, isn't that incredible? We haven't actually published this data. This is data that we had for a few years ago. But again, it's talking about the importance of 4-Life Transfer Factor and how you can distinguish 4-Life Transfer Factor from other products like that out in the marketplace. You can go out there with confidence and say it's NSF certified. We have patent processes. And we did head-to-head tests showing that 4-Life Transfer Factor is more active in a natural killer cell assay, in an immune assay, than any other product out on the market. So you can go out there and aim with confidence in 4-Life Transfer Factor.
Oh, wow. What a result. This is something that 4-Life has not made up. As we can see, these are from the third-party lab. This is amazing results. And this is something that the affiliates and the people that are joining our chat today is the first to know. We are very lucky to be joining our session tonight, and they have to be excited to go out and share this information, because not only that we are less expensive to the other products in the market, but we're also provide a much better result. And this is something that is proven. So wow, to 4-Life, this is something amazing to be sharing about. But so let us proceed to the next very important questions that we often get asked, which is to the next slide. Is there any efficacy tests on the 4-Life transfer factors in humans from all of the things that we've done? Please advise.
Well, you probably saw the title of this seminar, right? And so that's already going to tell you something. But to answer that question, to simply say yes would really undermine the importance of this question. So I will emphatically say yes. Yes, we have done studies on 4-Life Transfer Factor in humans. In fact, our latest study led to our most important claim about transfer factor, one that everyone can understand and repeat. And that is, drum roll please, next slide. 4-Life Transfer Factor is clinically proven to activate the immune system in just 2 hours. Let me repeat that. 4-Life Transfer Factor is clinically proven to activate the immune system in just 2 hours. So next slide, please. This study takes 4-Life to the next level in immune system support by leveraging decades, 25 plus years of transfer factor research in collaboration with a world-renowned lab, a clinical lab that specializes in uncovering immune system benefits of natural products. So over the last couple of years, 4-Life has partnered with NIS Labs, which stands for Natural Immune System Labs. They are a 20-plus year full-service clinical research lab with their own testing capabilities. So in this study, and I'm showing you a diagram here, in this study, NIS followed the gold standard for human clinical studies. What is a gold standard? It is a placebo-controlled, randomized, double-blind crossover study. So what does all that mean? Those sounds like fancy scientific terms. What it means is that participants in this study, in this clinical study, took one dose, only one dose of transfer factor, so that's 600 milligrams of transfer factor, or they took a placebo, which has no active ingredients, right? So it's not transfer factor. Now, during the study, just prior to the consumption of either placebo or transfer factor, they took blood samples at just prior, at 1 hour, at 2 hours, and 24 hours after consumption. They collected blood to be able to analyze the immune cells in the blood and specific markers that indicate the impact on the immune system. We can go to the next slide. So there are two ways to measure the impact on your immune system. The first is to look at the actual immune cells themselves, right? We have a lot of immune cells in our blood. And to understand what we're looking for, let's first recognize that our immune system is comprised of two different parts. There is the innate immune system, which consists of defenses that are very fast acting or within a few hours against health threats. And then there's this adaptive immune system, which is another part of the immune system that contains specialized immune cells which target health threats and prevent their growth in our body. The second way is to measure the impact of our immune system is to look at special biomarkers that we call cytokines. So cytokines, like transfer factors, are proteins that help signify our immune cells' ability to communicate with one another. So to mount a defense against the health threats, sorry, not that slide. Let's back up. There we go. Okay. To mount a defense against health threats, our immune system must coordinate its response, and it does so through expressing these things called cytokines. And what we found in the study is a robust cytokine response when comparing the action of transfer factor versus the action of placebo within the first 2 hours, right? So again, we're looking at cytokine response, we're looking at placebos, and we're looking at transfer factor, and we're all measuring this within a couple of hours. So these results were represented by change in two key cytokines. One of them is called interferon gamma, which we denote here as IFNG, and the other one is called interleukin 13 or IL-13. Now, this tells us that transfer factor is improving our immune system's ability to communicate, right? Recognize and respond, right? That's the immune cell's ability to communicate. When we look at the actual immune cells themselves, right? So we got immune cells and cytokines that we're looking at. When we look at the immune cells themselves, we also see a very positive change in what we call a CD25 marker for a special immune cell called a natural killer T cell. Again, when comparing transfer factor to placebo within the first couple of hours. So we now have data points showing how immune cells communicate with one another and how immune cells are activated with transfer factor compared to placebo in humans. It allows us to say with confidence that transfer factor is clinically proven to activate our immune system in just 2 hours. Okay, I know that's a lot of technical jargon, a lot of terms that you're not familiar with, but the whole basis of this research is to show that transfer factor can help activate your immune system in 2 hours. And we have data, we have a study to prove it. That study is almost going to be published in the next few months. We are waiting for our reviewers to publish this work so that we can show to the world, to the scientific community, that 4-Life transfer factor activates our immune system in just 2 hours. And we have data, we have a clinical study, a gold standard study to prove that out. Well, if you remember the study protocol, the claim applies to 4-Life transfer factor products that have at least 600 milligrams. So we have a number of products that have 600 milligrams as a single ingredient. We have transfer factor trifactor, we have Rio Vita, we have ProTF, number of different products that have transfer factor at 600 milligrams. There's also another, and so to get that effect, to get that activation within 2 hours, you have to consume 600 milligrams. And so we're recommending that you're taking your 600 milligrams every day so you can get your daily dose, you can get your immune system up and running every day. You can also achieve that same benefit by consuming a total of 600 milligrams. So not all of our products, you know, so we have some targeted products that don't have 600 milligrams. They might have a few hundred milligrams. If you combine those products so that at the time you take them, you're consuming 600 milligrams, you can still get that same benefit. It's just that the amount has to equal 600 milligrams.